But for this purpose, let's make sure because we're really talking about, setting criteria. So the first thing we do is make sure that someone is not contraindicated for these particular treatments. And that's where I always start. So when someone first, calls me up or sends me a message and they say, man, do you think laser would be good for this or shockwave would be good for this? And I said, well, let's first start with, do they have any contraindications? Or where are you going to be doing that, right? And so definitely screen for the contraindications and the precautions, right? Just like the example I just told you about, when we're dealing with someone with, a neurological attachment to their low back pain, I definitely want to think about that because knowing what I'm going to do to them is going to be important, right? So that would obviously be a precaution. And I don't know the whole details of this particular person. Maybe they had some form of stenosis, especially if it was bony, then I would definitely want to be much more careful when I might be delivering that, or I might not want to do it at all. So screen for, these contraindications, um, and, kind of be as detailed as possible. So obviously malignancy in the treatment area, really for both of these, is going to be a no-no. And then the other big one I always get, which is going to be pregnancy. Now, we can treat a pregnant person with both of these devices, just not in the area of the abdominal pelvic cavity, especially to the anterior. And then people will say, what about the posterior? Because that's not in writing. I say, well, you might want to, be careful with that. If I'm going to be in the lumbar region using something like Shockwave, I might want to be a little bit more careful and take that into consideration and use a potentially lower energy density, or maybe not use it all. And it depends on your level of comfort and your ability. So I'm not going to go through all of these. I mean,